Stroke is the second most common cause of death globally, accounting for 1 out of every 19 deaths in the United States, and is the third leading cause of death in Taiwan. In Taiwan, ischemic subtype accounts for 74% of all stroke, followed by intracranial hemorrhage, TIA, subarachnoid hemorrhage, and cerebral venous thrombosis. Stroke is also the most common cause of complex disability and an independent risk for dementia. The direct and indirect cost of stroke care is a considerable burden to both the society and patients' families. Although some risk factors of stroke are non-modifiable, such as older age and male sex, current known modifiable risk factors: hypertension, current smoking, high waist-to-hip ratio, diet, regular physical activity, diabetes mellitus, alcohol consumption, psychological factors, cardiac causes, apolipoprotein B to apolipoprotein A1 ratio, together account for more than 90% of population attributable risk for stroke. In addition to these risk factors, metabolic syndrome, dyslipidemia, and high low-density lipoprotein cholesterol have been identified as risk factors for intracranial atherosclerosis, an important mechanistic step in the pathogenesis of ischemic stroke. Vegetarian diet have been documented to lower blood pressure, glucose, and cholesterol, and reduce cardiovascular disease incidence and mortality. Other dietary patterns that emphasize plant foods have been shown to be protectively associated with stroke incidence. However, vegetarians tend to have low intake of vitamin B12, and this could raise homocysteine, leading to an increase in risk of stroke. In addition, previous studies suggested that some animal protein may be beneficial for the prevention of hemorrhagic stroke or improve cerebral infarction mortality. The combined effect of supposed harm of high homocysteine and the supposed benefit of low blood pressure, glucose, and cholesterol, unique aspect of vegetarian diets on stroke disease incidence is unclear. A previous pool analysis showed that the association between vegetarian diet and cerebrovascular mortality trends toward protection in men. Hazard ratio for a 0.77, 95% confidence interval, 0.57, 1.02, but not in women. Hazard ratio for a 0.98, 95% of confidence interval, 0.80, 1.20. The overall association is heterogeneous in different studies. Moreover, many studies looking into diet and stroke incidence tend to lack information on blood pressure, glucose, and cholesterol, making it difficult to examine whether the effect of diet is mediated through these relevant risk factors. We investigate the incidence of overall, ischemic, and hemorrhagic stroke in vegetarians and non-vegetarians in two prospective cohorts in Taiwan. In addition, we explored whether the association between vegetarian diet and stroke risk is modified by vitamin B12 intake. We hypothesized that a vegetarian diet protects against stroke through reduction of metabolic risk factors, and that this effect would be particularly strong among vegetarians with adequate intake of vitamin B12.